Good morning, everybody. Welcome to this edition of At Home with Tanya and Jolene. My name is Tanya Blosser. I am a local real estate agent here in the Northern Virginia area, and I'm a mother of two, and I am also married. I suppose I should probably say that. I say mom, and then I forget about the husband part. Anyway, and I am with my beautiful co-host today.
Hello, everybody. I'm Jolene Moore. I'm with Main Street Home Loans, a local lender in Northern Virginia that we help clients with purchasing and refinancing their home. I'm also a mother of three and wife as well. And we're very excited to have Dr. Kahn with us here today. So thank you so much for joining us.
Yeah, thank you so much for having me.
So Evan Kahn is a sports medicine chiropractor. He's also the owner of North State Sport and Spine. He is in his office today, and that is a sports injury clinic. He's been in practice for over 10 years, and he has been part of two USA sports medicine teams. So Evan, my first question is, which two teams were you a part of?
Yeah, so I was originally part of USA Archery there for about a year. Then after I moved into USA Fencing, in which I currently am still with. I've been with them for a few years, and yeah.
Wow, that is super cool. And so do you go to their tournaments and stuff? Is that how when they're in your area, or are you traveling with them?
Yeah, no, it's a regional thing. So kind of I could choose to do some international events, but typically I've done just some events that are close to me in North Carolina and in Virginia.
Gotcha. That's important to note. So you guys are in North Carolina, right? Holly Springs, North Carolina.
Yeah.
And so I thought one of the biggest reasons I wanted to talk to Dr. Kahn today was there's just so much going on right now. We're putting our bodies through a lot of stress, both with working from home and, all the challenges that brings. And then there's, those of us that have increased our exercise or we're workout warriors now, and people that have just started their workout routine. And so all of which is taking a toll on our bodies. And so I figured, amongst all the other expertise that Dr. Kahn has, that he can perhaps help us with some things to be kind to ourselves and stretching, and which I just have to be honest, excuse my French, I suck at stretching. So maybe by the end of our session today, you can help us with a little bit of that too.
Sure thing.
So tell us a little bit about the environment of North Carolina right now, where you guys are at with COVID, and then how, and then maybe as a follow-on to that, like how you've pivoted your practice since quarantine and stay at home.
Yeah, so North Carolina's just started to kind of reopen its doors a little bit. They're going through its phases. I think we're in phase 2 right now, which just started over the weekend. And so we started to kind of slowly to get back into things. Restaurants are starting to open. I think breweries are now open. Some community pools are open, but gyms are still closed. And a couple of other things are still closed, but we're starting to kind of go through our phases there. And the way that we've kind of transitioned our practice has been, well, one, we started to kind of pare down how many people we were seeing. So we were starting to just do one patient an hour to allow for proper time and cleaning in between patients. But we also started to use telemedicine sessions, which were just a great way to help connect with people in pain and give them some self remedies for self-care and how to improve their particular situation.
Did you find a big decrease in your patient and like the people that you were seeing and stuff? I mean, where they were still wanting to come see you, right?
Yeah, no, for sure. In the beginning, I mean, we had a little bit lighter schedule, but as the weeks have gone on, we're back to fully booked again. So we're booked for the week, and we've been good on that.
So even, I know you specialize in sports medicine. So even with no sports going on, I guess it's just other activities that people may be doing at home that are or is it ongoing kind of, issues that they had from sports in the past?
Yeah, it's kind of the same thing that we've always seen, which we get a lot of runners in in the office, in the clinic.
Mm.
And so they're still out running. They're trying to get exercise. A lot of people are
Yeah.
still trying to stay active, which is one of the best things we can be doing right now. But we're also getting a lot of upper back and neck pain from people sitting down in front of the computers, working from home. So
Yeah.
a lot of that type of lifestyle change for them. People were normally they'd be in the office walking around. They're at their desk. They're not really in a great ergonomic position all day long. Maybe they're working at their kitchen table or just someplace where or in their bed. And so they're getting a lot of upper back, neck, lower back pain just being in those positions.
You know what I've experienced a lot from being at home? Like you said, I didn't realize how much I moved during the day that I'm not moving now.
For sure.
And my leg pain, like my hamstrings hurt so much after sitting for a while. I'm like, it's amazing. Like I get up and I'm like, oh my gosh, I cannot walk.
Like, why are you having to fire them up again?
I know. It's like, like you got to move. Is that something that you would like? I mean, as someone sitting, that we need to like almost set an alarm that we're moving so often to try to, I guess, alleviate some of what you're talking about?
Yeah, 100%. It's funny how much underuse and overuse tends to feel the same. So usually when we're sitting down, we're putting pressure on those soft tissues, on those muscles. They tend to get really achy, and you get up and move around. You're like, oh my, I haven't walked in hours. And so yes, in general, we like to have our people get up and move every hour or so, just to kind of get up for a few minutes. And to walk around. It really helps kind of flush some things out and get the blood flowing again.
And I'm sure people are probably working a little bit more than maybe they would in a traditional office setting, because you've got your entire day open to you to work. And so if you have something that goes beyond just the traditional, working hours, which who has that anymore, of 9 to 5, I mean, I know I'm getting up earlier in the morning because I'm trying to get ahead of my kids. I'm working some early in the morning or late at night, all of which are in bad positions if I'm on my laptop, either sitting at a desk or on a couch or somewhere else where I'm finding it convenient to be, because I'm still just trying to shove in some extra work hours. I'm sure that's where, I've had chronic lower back. I've never had lower back pain, and I've had chronic lower back pain for weeks now because I think of all of those things that are just combining on my body.
Yeah, absolutely. 100%.
Yeah.
Well, it's just when you were talking, I was like slouching. I was like, oh,
I know. I'm like, oh,
I got my own reminder when we shut down for a couple weeks, and was forced to do a lot of my administrative work at home, and sitting in front of on the couch or at the kitchen table doing work, it was agonizing, and I remembered how bad it is to really sit for long periods of time, because normally I'm moving around all day long. I rarely sit down for more than 5-10 minutes at a time. And it made me acutely aware of how painful that stuff can really be.
Yes.
Yeah.
Yes. Do those, how people sit on like the large medicine balls and stuff? Do those really help with your posture and stuff when you're sitting at
probably to some degree. Yeah, probably to some degree. Not a tremendous amount, but it most likely a little bit.
Okay. What about the standing desks? That's a big thing too.
That.
Like I had one for a little while, but to me, I felt like that was not productive for me, like the way to get like right and all that kind of stuff. So I don't have one anymore. But do you find that to be, I guess, just to be able to get up and down? Is that beneficial?
Yeah, I think purely standing desk, you're going to find yourself have other problems, like your feet are going to start killing you.
Right.
Yeah.
So I think it's important to kind of mix and match a little bit.
Right.
If you've been sitting around for a while, go stand up. If you've been standing around up for a while, go sit back down. Sitting, for a little bit of time isn't bad. Okay, it's not like it's gonna just ruin you. It's just when we stay in that same seated posture for 6 to 8 hours a day without moving, without stretching, that takes a toll on you after a while.
Yeah.
For sure. Yeah. Oh my gosh. So we were talking a little bit about, again, traditional chiropractic care versus kind of what it's evolved into, till today, which is very different, I think, in terms of, and how you are seeing and treating patients and stuff like that with soft tissue. And so tell us a little bit more about that.
Yeah, so we kind of blend a lot of different things into one practice. So a lot of rehab, a lot of soft tissue work, some chiropractic, really just kind of all encompassing. We're trying to be a one-stop shop because that's just the way of that's how we need to be treating musculoskeletal complaints. It's not just one hammer for all the nails. So you really do have to have a lot of tools in your tool belt to fix all sorts of things that kind of come into the clinic. So kind of that newer school of chiropractic and even physical therapy is we're all starting to kind of come together and kind of blend that. And so one of the newer adages is if you can't tell if your doctor is a chiropractor or physical therapist, you're in the right place, because that means that they're in that newer school. They're in that kind of pushing the boundaries of their scope, and that's going to help patients more long term and have better outcomes. So that's why we're different. We do like to use all sorts of different tools like soft tissue work, dry needling, rehab, cupping, all types of exercises. So longer appointment times, better results.
So cupping, that's something I'm curious about. So you know how you see those circles on people after they do it? And I know Michael Phelps was a big one, when he did it during the Olympics. But is there something to it when it's like the redder it is? Does that mean the worse it was in that area? Is accurate? Or is it just the way, it just kind of your body reacted?
Yeah, no, I think it does depend on who the person is and what the complaint is, where the problem is. But in general, we do want to see some blood flow. So usually, the longer you leave them on, the more you're going to have a bruise. Also,
is that good? Is it good to have the bruising?
Yeah, I think so. I mean, that's something that we do want to see. We want to see a lot of blood get into that area. That's the whole reason why we're doing it. We're trying to decompress that tissue and just kind of open up the tissues, get a lot of blood flow in there. So in general, yeah, we do want to see some redness and some bruising. If we don't see a lot of redness and bruising, that's kind of interesting, because that kind of tells us like maybe the treatment was ineffective, or maybe we need to choose something else. So yeah, but I mean, in general, we do want to see a little bit of that bruising for sure, which is normal. It's normal to have that.
How long does it usually stay around?
That depends. I've seen it last weeks or months, even after one application. In other patients, it goes away within a week, but it really does depend.
I've had it done once, and it stuck around for a couple weeks. Some of them faded faster than others, like you're saying, because I think it depended on the blood flow. But yeah,
what about dry needling?
Yeah, dry needling is a very popular modality these days. It's a great way to again kind of draw attention to that area. The way that I kind of try to describe dry needling is the body has its own way of kind of sending its healing resources to an area. It's just like when you get cut, it tends to scab over, right? So it sends all the necessary things to that area to clean it up, get some of the debris out of there, and get it to heal. So dry needling is the same thing. We're going to put a little needle into the tissue. It's going to create a very small lesion, and the body's going to recognize that, and it's going to have to go send its resources to go clean up that area. So if we can identify which areas of the body need to get needled, we can really speed up some of this healing response. It kind of brings that inflammatory process to a quick resolution. So it works really, really well. And that's just one way it works. There are other ways it works too, which include blocking pain and getting some natural endorphins to start kind of churning away in there, which can really help if you're in a lot of acute pain. One of my favorite things to do is do some dry needling to the area, because it can really get you out of pain pretty quickly.
Alleviate. So do you use that across the board, like with anything from, an injury related to just something that is just chronic, based on just, someone just overuse or something like that, maybe? Yeah,
totally. Yeah. It depends on kind of where the problem is. There are some areas that we try to avoid or be very, very cautious, like around the chest and around the mid back, because we don't want to hit a lung. So we stay away from those areas for the most part. But yeah, I mean, it has all sorts of applications. For acute injury to chronic kind of repetitive motion injury, all that stuff, it can really be useful.
Is it similar to acupuncture? Like, is it the way that it's like the needle is, I guess, kind of put in and things? Is it kind of seem like that in a way?
It does. It does. So the way that dry needling has evolved just in the last, I want to say 5-10 years, has really become a Western version of acupuncture.
Okay.
So acupuncture, the best way that I can kind of describe this, and I'm not an acupuncturist, so acupuncturists should probably listen to me and want to choke me. But the best way that I can describe acupuncture, it's a whole different way of thinking about how the body heals and how to get what they term as chi, which is healing energy in and around the body. So if you have pain, if you have symptoms, they tend to think that there's not enough chi, or there's a stagnation of chi going to that area. So they try to stimulate what they call meridian points to try and get some of that healing response around. Dry needling is similar. And in fact, if you overlay a lot of the acupuncture points to what we would call trigger points and kind of look at those two maps, they look really, really similar. There's a huge overlap. So there's definitely something to both, and it all depends on the application and the type of patient, but both can be really beneficial. I'm a huge proponent of both. They are a little bit different, but in our practice, it's more of a dry needling setting where we're just trying to get some blood flow to the area and kind of stimulate that healing response.
I've never had that done. I so want to try that. This is such a ninny question. Is it painful?
It can be uncomfortable. It definitely depends. There are certain areas of the body that are going to be more sensitive than others. But in general, once the needle's in, you don't really feel too much.
Yeah, I had that done too. So
oh my gosh.
A few years ago, I was going through I had mono, and I just could not recover from it. Like my body was just like breaking down. And so they thought I might have Lyme, things like that. So I went to, a chiropractor, and like you're describing, I did a lot of different types of modalities within that, the soft tissue, the cupping, the dry needling, some, adjusting as well. I know we did other things too that I can't even remember. I'm just trying to get some relief because my body was in so much pain. So I didn't realize for Lyme, have you ever treated patients with Lyme, or, is that very common?
I have. It's not too common in my clinic, but I have seen patients with Lyme disease for sure. It really can be tricky to treat and even diagnose. I mean, I've had patients that we've seen a lot of different issues with them, and then come to find out they have Lyme. So it was difficult to tell in the early going, and then they needed more tests, and then they got those tests. So
it's hard. It's hard. I went through that.
Yeah, that's crazy. Wow. So I'm still stuck on the dry needling thing. So are you, sorry, I just have one more question. Are you using that? Do you use that as just one therapy to kind of go to something else? Is that like warming up, getting the blood flow and stuff before you start working on somebody? Or is that kind of like a I don't know, treatment or something like that?
Right. Kind of how do you structure it in a treatment? I will. It's it's a somewhat invasive procedure. So I usually don't do anything after I dry needle. I usually go through needling after, at the end of a session, or I only do needling. So I might adjust somebody first, or I might do a little bit of soft tissue first, and then I'll do some needling. And then maybe even after that, I'll do a little bit of rehab on top of that. So, but I generally won't do any more soft tissue work after I do needles. Needles are kind of usually the last thing, or I'm going to rehab them right after I do that. And there are just different reasons why I would do that. But it just kind of depends on the problem, how acute it is, if it's chronic. If we need to really strengthen an area, I might do it, right after we do some needles. So usually it's at the end, though.
Okay.
So you were talking about, kind of like if you're at the right practice, it's someone who's kind of expanding the scope and doing more than what we're kind of talk about adjusting and all the other different modalities you've included now. Is that part of schooling now for chiropractors? Are they including these practices, or is this something you're having to get education on outside of that? I'm just curious how that's evolved as well.
Right. When I was in school, we did do a lot of soft tissue and rehab as part of the curriculum. Dry needling was not part of that curriculum. We had to go outside and do some postgraduate, education. So today, I still think that's the case.
Okay.
I could be wrong, but I'd be willing to bet that they are not quite ready to make dry needling as a part of that curriculum. But all of the other things are generally speaking part of a chiropractor's curriculum, especially at more of the evidence-based schools. And so the more of the evidence-based school that you go to, without opening that can of worms, but the more evidence-based school you go to, generally speaking, the more rehab and soft tissue education you're going to get.
Okay. So it depends on the school you choose as well then.
It does. It does.
Okay.
There's probably about, I couldn't tell you exactly, but maybe 50-50. There are the ones that really want to look more towards the future. And then there are other ones that are just kind of more content with how chiropractic has been in the past.
So I know you're a runner, Tanya, and I used to be, but I had so much issue with my IT bands that I had to stop. And I still feel like I've been trying to start during this. I've been using the Peloton app and doing more of run walks or hits where it's more of building up to speed. And so it's not continuous. And I have found that that's not as harmful. My knee doesn't hurt quite as much doing that. But do you have any recommendations for IT band issues? If you did a telemedicine, something that you might give people to do at home for that?
Oh yeah. IT band syndrome is one of the more common things that I'll see in the clinic for sure. And always what we have to do is strengthen the leg, especially the back of the hip, the glutes. That's something that's so important for IT band, because in general, what happens with IT band syndrome is that your knee is caving in just a little bit as it's running, and it's causing a friction on the outside of that knee. Now, the best way to help kind of prevent that is to keep that knee from collapsing in. And the way to do it is to strengthen the back of the hip, strengthen the glutes. So very common exercises that I prescribe for IT band syndrome are glute bridges, different types of lunges or squats. And we're just focusing on the biomechanics. We're focusing on just strengthening that section of the body so that it can be prepared for the actual impact and landing of the run. So guys, strengthen the glutes, no doubt about it.
Okay. All right.
So you actually put out, Evan, you on your social media channels, and that you put out some videos and stuff too, right? On some of the things that he's talking about. I've seen them in the past, and cool. They're really, really helpful. Okay. Super helpful. Awesome. So we'll definitely, I'll share this. I'll tag you in your page and stuff so that we can get some of that shared out there too, because they're great videos.
Well, thank you.
Awesome. Okay. Thank you.
All right. So I have to ask you a little bit of selfish reasons, like lower back stuff. Sure. So I don't know. I think I'm kind of self-diagnosing that I think it's sleep related for me. So is there something that you can share with us in terms of how we sleep? And I mean, I have tried so many different things about trying to sleep, but every morning I'm getting up and my lower back is an issue, and my lower back into my right glute. It's just, it takes me a while to warm it up. And then once I get it, and I have to take a little Motrin, which is not good. But anyway, once I get it there, I can function.
Yeah. So sleep related back pain, that's a tough topic. People ask me all the time, what's the best way to sleep? I know that there's one really bad way to sleep, and that's on your stomach. Most people can't really sleep on their stomach and get away with it for long periods of time. If you're going to sleep on your side, it's probably a little bit better for you. And then there are certain positions once you're on your side that I think that are a little bit more of more ideal. And this is totally going to depend on your body and your body shape, and also your bed and how firm it is or how soft it is.
Yeah, it's part of my problem too, I think.
In general, if you're on your side, so are you sleeping on your left or your right side, or on your back?
I'm usually a right side sleeper.
Okay, and it's the right side that's hurting.
Yes.
Okay, so what's the left leg doing?
Well, honestly, I have one of those pillows that you put in between your knees.
Okay.
So it's usually right on, because I thought maybe let's try that.
Yeah.
And so usually they're right on top of each other, but the pillow's in between.
Gotcha. And do you find that comfortable, or is that uncomfortable?
It's comfortable, just not when I wake up.
Okay.
But while I'm sleeping, it's comfortable.
What I would try to do is take that left leg, keep that pillow, but bring the left leg a little bit more forward, and so that it's not on top of the right knee, but more of like a 90-degree angle coming out, and then put the pillow in between the bed, the mattress, and the knee. Okay, so not on top, not on knee to knee, but knee is kind of coming over about 90 degrees in front of it. Try that, and then you might want to look at if your like hip is sinking down into it, or if you're not in neutral when you're laying on your side. So ideally, we want to have a neutral spine and neutral pelvis when we sleep. If that's not the case, you're probably going to wake up in pain. You might also just need to try and do something a little bit different, like sleeping on your left side or sleeping on your back for now. Just kind of give that right side a break. It might just be being compressed a little bit too much, and it just needs a breather. Have you tried changing positions? Have you tried sleeping on your left-hand side or on your back?
I do shift. I start and usually end up on my right side, but I do shift throughout the night because my hip, I'm not in a neutral spine. And I think you just hit the nail on the head for me, which is part of my problem. And I figured that was it too. But so my right hip gets just sore throughout the night because I'm usually on that side.
Right.
I can't sleep on my stomach, but I think that's probably sounds like that's a good thing.
Yeah.
But I also find that there are times that I'm like half and half, like my knees will be on the side, but then my shoulders are back. You know what I mean? Like I'm somewhat twisted. I don't know what that means, but anyway.
Yeah, I know exactly what you mean. You look like a pretzel.
Yeah, like a pretzel.
Yeah, not ideal. So try to give that right side a break.
Okay.
Or rotate the mattress. There's indentations that occur in the mattress when you sleep on the same thing every once in a while. Or tell Leif to quit waking you up in the middle.
Yeah, exactly. I'm just gonna blame it on him. Well, thank you, Dr. Kahn. This was super awesome. This was really great. We end every one of our episodes with even though we're kind of getting out of binginess, we end the episodes with kind of what you've been doing during stay-at-home quarantine. The first one that we usually ask is, what is your favorite show or podcast, or what have you been binging, TV related, or I don't know, even if it's a book or something like that.
Yeah, what have I been doing? I don't even know. It's like time has moved in such a weird place.
Continuum.
I can't even tell you. I know we watched Westworld on HBO. So we finished that. I know there's another show that we've been watching. Tiffany's gonna kill me.
Because you forgot.
Oh, we started to watch the Last Dance, which is that Michael Jordan thing. That's excellent. We still have to go with that.
Very good.
Yeah, excellent. No, honestly, what I've been doing to keep the time is we've been doing a lot of the Peloton, which has been really, really useful. I've been doing more yoga, and just kind of expanding my athleticism that way.
Okay, can I ask you a question about the Peloton? Even though we're like in question, and we're in binge watching question mode. So I have one as well, and I was wondering. I know. Okay, cycling. Does that make your quads like you're bigger than like running? Because I feel like my legs feel bigger since I've started the Peloton. I'm like, is there any validity to this, or am I just crazy?
Oh yeah, I mean, absolutely.
You're crazy. No.
I think if you looked at a cyclist quads and a long distance runner's quads, you're definitely going to see differences.
Yeah.
it also depends too. Like this, the cycle is a push and a pull at the same time, right, on either side. And I think most people will just push instead of kind of dragging and pulling the hamstring back up. So if you're just going to push, it's going to be a lot of quad. You're going to get that front of the thigh just huge, and you're going to totally miss the back of your leg, which is the hamstring. You got to pull.
Okay. All right. I'll be more cognizant of that because I've been feeling
that is so true.
I don't know if I want to keep doing this. I feel like my leg is getting bigger. All right. Sorry to Dr. Change copy there. All right. So what is there any, it sounds like you're pretty healthy, but is there any kind of food, even if it's a healthy food, that you guys are just loving and it's been something you're eating quite often during all this time?
Yeah, we switched recently. We started to eat more of that kind of Mediterranean diet style, which is a lot of greens, a lot of lean meats, and some red wine, actually. So
no, that's good.
No, that sounded like a lush, but no, it's we've been eating a lot more greens lately, and a lot more vegetables, tomatoes, and a lot of kale, a lot of spinach. So yeah, we've been eating a lot of that stuff.
That's good.
That's good.
Yeah.
That is so good.
Much better than what I've been eating.
I know, right? Oh my goodness. S'mores. It's becoming s'mores evenings. Like every evening around here is a s'mores evening, and that's just really dangerous for me. Oh my gosh, but they're so good. Okay, last and final question for you, Dr. Kahn. So you kind of answered it before, but do you have like a hobby or a pastime or whatever? You're like, I just need to get to doing this because it helps me unwind or release stress or something like that, that you're finding you're doing more now than you did before?
Yeah, I love to golf. Actually, it's definitely a big passion of mine, and I haven't been able to golf as much recently. But getting out, and it's not just like actually golfing. It's really just kind of getting out on a nice day. It's being kind of a little bit in nature, and golf is an interesting, it's a humbling experience. It's not always fun, but it's always a good time.
True.
Yeah. The short game, especially. That thing is tough.
That's awesome. Well, and maybe the timing of everything is going to be just right, right? We're getting into warmer weather, getting into the warmer season. Things are starting to relax with, things being shut down and opening it up. So now you can get out and get on the course again.
Yeah.
Fingers crossed.
Well, thank you so much. And thanks for all the information. It was super helpful, and it was great to meet you. So I really appreciate it.
Awesome.
Thanks so much for having me. I love y'all's show, and I hope you guys keep it up.
Thank you very much.
Thank you so much. All right. Okay. Bye, everybody.
All right. Bye.